So for this medicine video talk, we're going to discuss examination of an injured or infected hand, really, in a A&E setting. And the first thing one has to remember is that the history is quite important in directing which bit of the hand you're looking at, and what elements of your examination you need to place more importance on. For example, if this lady came in with a history of a Stanley knife injury and she had a laceration over the volar aspect of the proximal phalanx of the index finger, then examine the little finger doesn't make any particular sense, because you're really checking for injuries to that finger. However, some people can come in with injuries to the whole hand, and for the purpose of this video we're going to talk about how one looks at the whole hand. So from the examination point of view, start with the global view. I always suggest that we look at the global view of the back of the hand, the dorsum of the hand first, because this is the bit that people tend to miss. So look at the dorsum of the hand, and you're looking for swelling, you're looking for paleness, congestion, erythema, bruising, any wounds, any discharge of things like pus, any deformities, i.e. are they holding the hand in a funny position, is the digit pointing the wrong way, and then you can turn the hand over and do exactly the same thing, looking for exactly those sort of things on the volar aspect. If a person has a flexor tendon injury, you may find that they're actually holding the finger in this sort of position, the pointing sign. That forms part of the flexor tendon injury examination. Now, if a patient has an infected digit or an infected hand, along with the swelling and the redness, and obviously you get tenderness on palpation, there's some specific signs, and it's for flexor tendon sheath infection, the four signs with the Carnival signs, which are if the patient's holding the finger in a flexed position because they don't want to extend it because it's sore. There will be a sort of fusiform swelling, and this patient doesn't have it, but if those fingers swollen in a sort of sausage shape or fusiform manner, and then if they complain of pain when you try to passively extend the finger, or pain on palpation along the flexor sheath, then you're thinking those are Carnival sign, and they have a high index of suspicion for a flexor sheath infection. Now, on the high index of suspicion, that's an important factor in all of this, is that when you're examining a hand, you've got to think what can be injured and assume something is injured unless you have totally ruled out the injury. And not having a high index of suspicion is the reason why many a time people miss injuries. For instance, if you've got a small cut on the hand and a patient you're checking for flexor tendon injury, for instance, and they're able to flex, but it's a little bit painful to say, oh yes, they're able to flex, that tendon must be intact. It may not be intact, or it may be partially intact, and you've got to think of these things and say, do we need to explore it? Now, the next thing we're looking into as part of the global thing is the vascularity of the digits. And looking at the vascularity, you look at the fingers and see if they're pink, first of all. And if you actually look at the nails, you can look not only at whether they're pink, but you look for capillary refill. So essentially, you blanch the finger, and you should be able to see that there is quite white, and when you release it, that blanching then goes away as the blood surges back, and you want it to fill back in quickly, but not too quickly. The 1 elephant, 2 elephant rule applies quite nicely there. When a finger is devascularized, you can get, as I said, quite a pale looking finger, but on occasion it can be bluish or mottled as you get the venous engorgement as well. So that gives you an idea of a global view. Now we're going to do some separate videos on looking at the flexors, the extensors, the bones and joints, etc. So do look at those for a more complete assessment of an injured hand.